In most of our postoperative patients, we'll treat your pain with what's called a multimodal pain program. That's a combination of Tylenol, some sort of anti-inflammatory or an NSAID. Common ones here are Advil, Meloxicam, Celebrex, Aleve, things like that. And then occasionally with a narcotic pain medication as well. Narcotics are tramadol, oxycodone, and hydrocodone. The general rule of thumb is we'll stagger Tylenol and an Advil or something in the NSAID class for primarily treating your pain. With this, a common dosage is to take each of these every 6 hours. So for an example, the Tylenol, you'll take a dose at 12 a.m., 6 a.m., 12 p.m., 6 p.m., or the 12s and the 6s. For Advil, if the dose is the 600 milligrams, which normally is prescribed, you also take that every 6 hours. But instead of taking Tylenol and Advil together, stagger them. So if you take a Tylenol at 12 a.m., 3 hours later at 3 a.m., you'll take your first dose of Advil. 6 hours later is 9 a.m., another dose of Advil, 3 p.m., and 9 p.m. So Advil will be taken on the 9s and the 3s. Now, not everyone can take Advil, so make sure that we have this conversation prior and you have a good understanding on whether you'll be taking an anti-inflammatory or not. Overall, these two drugs can be taken on a scheduled basis, meaning that you take them every 6 hours on the schedule, even if you're not having much pain, for the immediate postoperative period. Narcotic pain medication will usually be prescribed as well to be used for breakthrough pain. Now, a lot of people will give you the suggestion to stay ahead of the pain. That's with these two drugs. Only take the narcotic drugs if you really are struggling with pain and you're not getting the relief after taking the drugs on this side. The narcotic medication can be taken independently of this schedule. Generally, it's prescribed every 4 hours as needed for breakthrough pain. The reason we try to limit the number of narcotics is they can cause nausea, they can cause constipation, as well as a significant addiction potential. So anything we can do to limit the amount of narcotics needed for your postoperative pain control is something that we're primarily trying to do.